Well, good day. It's my pleasure to be here, and thank you, Mary. As chair of the Senate Subcommittee on Aging and Long-Term Care and the first Alzheimer's Association Legislator of the Year several years ago, I am very proud. Thank you. I am very proud to join you today. 3 years ago, at the request of the Alzheimer's Association, I authored SB 491, that was back in 2008, that created the Alzheimer's Disease State Plan Task Force in order to update the last state plan that was released back in 1987, and of course a lot has changed since then. The 2011 state plan that we roll out here today will prepare California and its people for over the next 10 years for one of the greatest healthcare challenges yet. You can tell I'm emotional about this because I truly understand the stakes. As we know, Alzheimer's disease is a major public health crisis, maybe the major public health crisis for the 21st century, and California must begin to prepare now. In this room, we all know the statistics. 1 in 8 individuals over age 65 will develop the disease, which means that many of us in this room will be affected. Alzheimer's disease is the 6th leading cause of death in California, and the number of Californians with Alzheimer's disease is expected to double by 2030. That's not that far away. That means there will be 1.1 million Californians with Alzheimer's disease, all of whom will need caregivers. I mean, it's just staggering when you think about that. Given these statistics, it is morally imperative that we deal now with this epidemic. So we assembled a task force with the best minds and most nurturing spirits in the state because we know that it takes both on this kind of issue. Together, these great thinkers have created an innovative state plan that will prepare California for the challenge ahead. I want to mention 3 things under the plan. The state plan has identified new ways to conduct research about the disease and remove the stigma so that people will seek early diagnosis and treatment in order to mitigate the devastating effects of the disease. Second, the state plan also creates a culturally competent healthcare workforce so that we can address the unique needs of individuals with Alzheimer's and dementia. And third, another recommendation includes implementing a public health approach to the disease so that brain health is equally as important as physical health. And I think we understand in this room that brain health can really get you if you don't have that. I'd like to speak about caregiving for a little bit. One recommendation of the state plan that I hold near and dear is supporting family caregivers, for they are the foundation of our long-term care system. I know this because more than once in my 66 years, I have been a caregiver. The last time to my late husband, Al Alquist, who passed away when he was almost 98 years old, and was able to stay at home with me for me to take care of him until the last 6 weeks. I know, and I was a lot younger back then, so I look at darling little ladies who are in their 80s who are taking care of their spouses or the other way around. And I just wonder, how do people do this? What happens when you're not able to recognize your best friend, who hopefully, if you have a spouse, is your spouse? What if you can't recognize your parent or your child or your niece or whatever the case may be? So, but anyway, I was the one to give him showers, to administer medications, to care for his mind and spirit. And let me tell you, it was probably one of the hardest things, but most loving things I've ever done. I never had to think twice about whether I would do it or not. I knew that I had to do it. And I know a lot of people today, women and men, are faced with that situation. So this hard work goes on, often unpaid and unseen by the rest, and unappreciated by the rest of the world. With only 6% of individuals with Alzheimer's disease residing in nursing homes, we know that family caregivers are the unsung heroes of this disease. Women disproportionately are the caregivers. They often have to take time from their careers, putting their own financial security at risk then and later in order to take care of their loved one. By some estimates, California caregivers provide 952 million hours of unpaid care per year. That's an economic value of over $10 billion. So we must recognize, value, and support our caregivers because we could not be doing it without them. I'd like to talk for a moment about the budget and how this relates. As a senator, a senior, and a yaya, that's a Greek grandmother, and as one who was trained who has a degree in mathematics, I have agonized over the least of the worst choices I have been having to make as a member of the Budget Committee. Like my Democratic colleagues, I try very hard not to make the cuts to Health and Human Services. But still, with a $26.6 billion deficit, there are a lot of cuts we've made, either in sub 3 or in the full Budget Committee. Senator Leno, chair of the Budget Committee, can attest to this. With a dementia patient costing Medi-Cal more than double what other patients cost, $25,000 versus $10,000 per year, we have a fiscal imperative to manage this epidemic with a coordinated and strategic plan, and it is an epidemic. If we don't, we could bankrupt the Medi-Cal system. And in closing here, I would like to extend a special thanks to Jackie McGrath and to the Alzheimer's State Plan Task Force, as well as the Alzheimer's Advisory Committee. You did a stellar job. For your remarkable work to identify ways to improve our response to this public health epidemic. I look forward to working with you to carry the first piece of legislation implementing this plan. And so I want to say to you all, thank you very much, and we will continue the fight. Thank you.